Emergencies and How to Treat Them by Joseph Howe, and this is from 1871. And of course, let's start with Chapter 7, Extraction of Foreign Bodies. Specifically, foreign bodies in the air passages. It is not unusual for worms to find their way into the larynx during sleep, or for bronchial glands to become detached and carried upward, producing serious and even fatal results. A violent blow on the back, if given immediately after the accident occurs, will assist the natural efforts of the patient in ejecting the foreign body. Back blows are still a thing, that's not so bad. And should the urgent symptoms continue, which they're liable to do, laryngotomy or tracheotomy must be performed without delay. Again, not so silly. Foreign bodies in the urethra and bladder. Slate pencils, hairpins, knitting needles, wires, pieces of wood, leather strips, straw, tobacco pipes are among the long list of articles which have been extracted from these organs. Foreign bodies in the rectum, however, are a rare accident. How things change. Moving on. For hysterical coma, which is not a thing, the cold douche is the best known remedy. 2 or 3 pitchers of cold water poured from a height upon the face will generally suffice to bring about a recovery. Moving on to complete unconsciousness. Cold water thrown violently in the face or sprinkled forcibly on the chest, striking the palms of the hands and rubbing them rapidly, efficacious in all cases. Are they? Now this is interesting. Should they fail, galvanism, i.e. electricity, may be carefully tried. One pole of the battery may be placed at the upper part of the spinal column and the other moved up and down over the sternum and precordia. So they're using pads in the AP position. Whether they're actually defibrillating anyone or not, who knows, but that's kind of cool. And epilepsy is connected with, most importantly, masturbation, venereal excesses, and syphilis, cerebral tumours, fright, etc., etc. Back to hysteria. Unsatisfied and uncontrollable passions, masturbation, etc. are not infrequent causes. Mixing our two favourite things, hysteria and masturbation. Chapter 20, Toxicology with Narcotics. Now we're talking. Here's a case report. A woman was admitted in the summer of 1866 to the pavilion attached to Bellevue Hospital, suffering from a bad attack of Asiatic cholera. When brought into the ward was fast approaching a state of collapse. She stated the attack came on 4 hours previous, and while at the station house half an hour before her admission, a policeman had given her a tablespoon of pure laudanum, which is opium. In about 3/4 of an hour, the nurse in charge informed me that the patient was insensible. So injections of brandy and ammonia and strong coffee were ordered. The body was properly stripped and flagellation applied with twisted towels. After 2 hours of this treatment, signs of consciousness appeared. The patient was then lifted from the bed and rapidly marched up and down the ward supported by her nurses until she was fully restored. Now belladonna, that's an anticholinergic. Brandy by enema and opium by hypodermic injection in conjunction with large doses of lime water constitute the most reliable remedies that have yet been fixed upon. And digitalis, treatment is more brandy. And lastly, tobacco overdose, for which the treatment is, you guessed it, brandy by enema. Man, those were the days.